we shall discuss about the anatomy of the scapular region. We'll start with the muscles connecting the scapula to the humerus. The muscles of the shoulder girdle are also called as intrinsic shoulder muscles. They're also called scapulohumeral muscles because they join the scapula and the humerus, and they act on the glenohumeral joint or the shoulder joint proper. They're relatively short muscles and they're 6 in number, namely the deltoid, the supraspinatus and infraspinatus, the teres minor and teres major, as well as the subscapularis. Now coming to the first muscle of the scapulohumeral group of muscles, which is the deltoid. It has got the shape of the Greek letter delta, hence the name. The deltoid is a powerful triangular muscle which covers the shoulder and forms the rounded contour of the shoulder joint. Now coming to the origin of deltoid muscle, it has got 3 origins. One is an anterior unipinnate, then we have a middle multipinnate, and thirdly a posterior unipinnate part. The anterior unipinnate part arises from the anterior aspect of lateral 1/3 of the clavicle. The middle multipinnate part arises from the lateral border of acromion. The middle multipinnate part arises as 4 septae. They come down, converge as 3 septae and gets inserted. The multipinnate arrangement gives the middle acromion part the greatest strength out of all the 3 parts of the deltoid muscle. The third origin is from the posterior unipinnate part, which arises from the lower lip of the spine of the scapula. Now coming to the insertion of the muscle, the fibers of the deltoid muscle converge to form a short, thick tendon, and they get inserted into the V-shaped deltoid tuberosity on the humerus. The muscle is supplied by the axillary nerve, which is called the root value C5 and C6. Coming to the actions of the muscle, the middle fibers, which are the strongest fibers in the deltoid muscle, they help in the abduction of the arm, especially from 15 degree to 90 degree. The anterior fibers are involved in flexion of arm and also in the medial rotation of the arm, while the posterior fibers helps in extension as well as lateral rotation of the arm. Intramuscular injection is given on the bulk of the deltoid muscle. The site of injection is 2 fingers below the acromion process. The supraspinatus is the second muscle in the intrinsic shoulder muscle group. Coming to the origin, the supraspinatus muscle originates from the medial 2/3 of the supraspinous fossa of the scapula. The supraspinous fossa is the space above the spinous process of the scapula, as is clear in the diagram. The muscle gets inserted into the greater tubercle of the humerus bone. It is supplied by the suprascapular nerve with the root value C5 and C6. The action of supraspinatus muscle is to initiate abduction. That is, the supraspinatus causes 0 degree to 15 degree of abduction of arm. Later on, from the 15 degree to 90 degree abduction is caused by the deltoid muscle. The next muscle to be discussed is the infraspinatus muscle, which is a thick triangular muscle, and as the name suggests, it occupies most of the infraspinous fossa. Coming to the origin of the muscle, it arises from the medial 2/3 of the infraspinatus fossa of the scapula, and it gets inserted into the greater tubercle of the humerus. The infraspinatus muscle is also supplied by the suprascapular nerve C5 and C6 root value. It helps in the lateral rotation of the arm, as is very evident from the origin insertion. If the action is towards the insertion, when the muscle contracts, it has to cause a lateral rotation of the arm. Next up, we have the teres major muscle. It must be interesting to note how the teres major muscle passes obliquely from its origin to the insertion through the axilla. So, as is evident from the diagram, it takes origin from the inferior angle of the scapula as well as from the lateral border of the scapula in its dorsal surface, and it is from the lower 1/3 of the scapula bone. It is passing obliquely and it is inserting into the medial lip of the bicipital groove of humerus. The teres major is supplied by the lower subscapular nerve with the root value C5, C6 and C7. Now coming to the action, if we imagine the muscle to be contracting and the action to happen from the point of insertion, we can see that the teres major can cause adduction of the arm as well as the medial rotation of the arm. The teres minor muscle is up next. It is a narrow and elongated muscle. It originates from the dorsal aspect of the scapula from its lateral border. So it originates from the upper two-thirds of the dorsal aspect of the lateral border of the scapula. It gets inserted into the greater tubercle of humerus and is supplied by the nerve to teres minor, which is a branch of the axillary nerve, that is C5-C6 root. The nerve to teres minor has got a pseudoganglion also. The teres minor muscle causes lateral rotation of the arm. It also acts as a weak adductor of the humerus. The last muscle to be discussed among the intrinsic muscles of the shoulder joint is the subscapularis, which is a bulky triangular muscle in the subscapular fossa, which means that the muscle is not dorsal, it is on the ventral aspect or the costal aspect of the scapula. The subscapularis muscle takes origin from the medial two-thirds of the subscapular fossa and it gets inserted into the lesser tubercle of the humerus. The subscapularis muscle is supplied by the upper and the lower subscapular nerves. It can cause medial rotation of the arm, as is very evident from the diagram. If the action is from the point of insertion, then when the muscle contracts, it can cause medial rotation of the arm, which means that there is also adduction of the arm. The subscapularis also contributes to provide stabilization of the shoulder joint during movement. Now we shall discuss about the rotator cuff. The rotator cuff is a musculo-tendinous cuff, which means it is formed by the muscle as well as the tendon. The four muscle and their tendons contribute to the formation of rotator cuff. They are supraspinatus, the infraspinatus, teres minor, and the subscapularis. So the tendon of these four muscle, the four sits muscle, are the supraspinatus, infraspinatus, teres minor, and subscapularis. They fuse together with the underlying capsule of the glenohumeral joint to form the rotator cuff. The tendon of the supraspinatus muscle would fuse from the superior part. The tendon of the infraspinatus and the teres minor would fuse from the posterior part, and that of the subscapularis fuses from the anterior part to form the rotator cuff. So the primary function of the rotator cuff is to hold the large head of humerus against the small, shallow glenoid cavity and thus stabilize the shoulder joint during movement. In the diagram, it is clear that the tendon of the supraspinatus muscle contributes from the superior part. The tendon of the infraspinatus as well as the teres minor muscle contributes from the posterior region, and the tendon of the subscapular muscle contributes from anterior part to the rotator cuff muscle. So it is clear that the rotator cuff is deficient inferiorly, and therefore the inferior side is the site of potential weakness of the shoulder joint. Hence the inferior dislocation of shoulder joint is more common. Thus we have covered the important anatomical points from the scapular region. Hope it was helpful.